and your kidney. Of course, you know that this program is audience participatory. I will soon put on the phone so that we can ask our questions, and Nurse Onovo is here to respond to every one of our questions. So, and having said about the signs and symptoms of a bad kidney, or what you will see. Okay, continue.
Okay, we're not really exhausted then. So we've talked about the weakness. The legs will be swollen. Okay, so that swollen leg is one of the cardinal signs, one of the things that move people. Because it's very popular. So when the legs will be swollen, the weakness is there, the blood pressure tends to become higher. Then the person tends to also make frequent trips to the toilet, especially at night.
Okay.
So these are the things that when you start seeing them, then foamy urine, the urine now starts foaming, and the weakness and all the rest of them. These are the things that when you see them, you need to start running. You need to start asking questions.
Okay, so let me. So we're talking about something in a group the other day. Someone said something about excess water. That's a weight loss group. So people were saying that they do more water. They do more water like every second. They want to take water. They want to keep hydrated because they said we should always be keep hydrated water and all life. Of that. Water is life. So is there any way excess intake of liquid or water, let's say water, not liquid, affects the kidney?
Okay, there is what we call I think I can't remember, the name is not coming readily, water overload or something there, but there's a name, it's called medically. But the truth is that this doesn't just before someone start having that means the person have drank to stupor. Okay, so daily a person should consume about 2 to 3.5 liters of water every day.
Okay,
that's the normal amount of water you should take. That is optimal. So by the time you're taking more, you may be actually be giving your kidneys more work to do. So we advise people to drink more during the daytime. And that is my own personal advice though. Drink more during the daytime, then drink less at night, so that your body, you can actually have a nice rest. Because by the time you don't sleep enough very well at night, waking up 5 times to move to the toilet, you also stress your body. High blood pressure comes in, little by little the body is breaking down. So going in the morning, drinking more during the day when you're active, you sweat, and the other ways of losing fluid, so the body tends to work around it. So water is the world best kidney cleanser. Someone will ask, maybe if you open the phone line and someone will start asking, how do we cleanse the kidney? Water does that very well, 100%.
Okay. All right, so at this point, we'll open the phone line for you to call in and make your contribution on the program or ask your question. The number is 0813-593-3112, 0813-593-3112. Call in, make your contribution, drop your questions online. We'll pick them and then he will respond to that immediately. And moving forward, now let's look at what a kidney stone is, what causes kidney stone, and all of that, how we can prevent that as well.
Okay, kidney stone is actually a solidification of...
Okay, not like it's a stone that will go there and stay.
No, it's a solidification.
Okay.
Of a hard mass in the kidney. This may result from waste products. It could be due to minerals. It could also arise due to not taking enough water. So we all know by now, all of us know the position of the kidney. So one of the key signs that someone has kidney stone is that this person would have lower back pain. Okay, that lower back pain is that site where the kidney is located. So someone can have either one kidney stone or most of the time multiple stone. And aside from having these...
Hello, good afternoon.
Good afternoon.
Your name and where you're calling us from?
This is the next group. I'm calling from office.
All right, sir. Go ahead with your question. Hello, are you there?
Yes.
Okay. Go ahead with your question, sir.
Among these two groups, one is in this topic you are discussing. The people and the people drinking some break like and all of that.
Please, you may have to repeat that question.
I said,
Okay.
I'm not get to the person. Which one is you are discussing? Drinking beer and the people drinking soft drink like mineral malt and other soft drink.
Nke na-abananya na nke na-abananya.
Hello,
You
sir.
get the question, right?
Oh, we
Hello?
are
Yeah.
not having. Hello, are you there? Please call us back, okay? Call us back. Step away from where you are so that we can have a hitch-free conversation with you. Hello, good afternoon.
Yes, sir. Hello?
Hello, please step
Hello,
away
good
from your
afternoon.
radio.
Can
Okay, I can hear
I
you.
am Mr. Chukulori, calling from Akron.
Okay, sir. Go ahead with your question.
My question is this. Like the meeting that I attended this morning, we were told to be able to do more about to prevent suicide. For men that are above 30, they should drink more water to control suicide. Now they are telling us not to drink much water. Which one do you take?
Okay,
Thank you.
sir. All right, sir. I think he just joined the program from midway. He said they are advised to take water, and now he's hearing that he should not take water. But please do a recap of water again,
Okay.
as it regards to kidney.
All right. I said that water is our friend. Like before I started, I said that water no get enemy. And I said that water is also life. So I said that if you have a healthy and functioning kidney, that you may not have water overload. Okay, you may not. There's not like maybe too much water, but in health, you should maintain about 2 to 3.5 liters of water every day. So water is actually okay for your kidney. Then I said that water is actually the world best kidney cleanser. I think I was clear about that.
Yes. So for you to get your kidney cleansed, you have to keep taking water. But he advised that for you to have a proper night's rest, you should take more water during the day when your body is active, right?
Yes.
Then when because it's night and you need that rest, you may have to reduce the quantity of water intake. Did you get that clearly? Hello, good afternoon. Hello? Okay, you may have to call us back, and the number is 0813-593-3112. So we're looking at kidney stone and how it's formed and how we can avoid it.
Okay, yeah. Okay, I've actually said what kidney stone is. Then I've also said one of the key signs of kidney stone. And I also want to buttress that someone who has kidney stone may also have make frequent trips to the toilet. They may also have foamy urine and not the rest of them. And these signs also can look like the sign of someone who is starting to have kidney issues. So how would you be able to, as a layman, differentiate both of them? You may not really be able to do that if you don't seek for medical advice. Okay, and our people, once they know how to Google their symptoms. Yesterday, I was talking to a group of persons about Googling their symptoms. By the time you go to Google and you're asking about this and that, they may start giving you things that are not there, and it increases your anxiety. And there's something they call psychosomatic disorder, that disorder that starts from the mind and all the rest of them. By the time you know, your body starts acting like it's like that thing is there while the thing is not really there. So then, for kidney stones, we have about 4 types of kidney stones. We have different types of kidney stones. Okay, we have the one we call the calcium stones. That's the most popular stone. We have the uric acid stone. We have the struvite stones, and we have the cystine stones. So these are the kind of stones that we have. So all of them.
You may want to break it down.
Yeah, calcium stone is caused by when someone has a lot of calcium in the system.
Okay.
It could be due to a particular endocrine disorder, or maybe this person is on calcium supplement and all the rest of them. So it's actually found the most common kind of stone that anyone may have. So it grows. It's very difficult to dissolve. So it forms very, very hard mass. Then we'll have the uric acid stone. Uric acid stone arises from a waste product of protein metabolism, a waste product of protein that gives rise to uric acid. So the uric acid is supposed to be removed by the kidneys. So because they have so much of it, they can aggregate, come together, form a hard mass. And another thing that this person may actually experience is joint pain. Someone who has high uric acid may have joint pain. It's called gout. Then the ankle may become reddened, swollen, hotness, all the rest of them. Then we'll now talk about the next one, the struvite stone. This struvite stone is often being predisposed by infection when someone usually have urinary tract infection, UTI. So this person may end up developing struvite stones. And one thing about struvite stone is that if struvite stone stays in the body in the kidney for a very long time, it can lead to what we call Stangon stones. Stangon stone is actually a stone with a horn.
Okay. Hello, good afternoon.
Very good afternoon to you.
Your name and your location.
Emeka Walker from different.
All right, go ahead with your question.
Doc, I greet you.
You're welcome, sir. Nurse Victory, sir.
Because the new training can use.
Igbo. Swaibo. Igbo.
I can help with it. The big Christian one. I don't know life may make it mana ya na bia efi hele bokatine adapa no efo na ndi ba ya malotago ide ni ide ha ma because they can always mana ha na arabi da through doctor ha ondi da kuziri hi uti ha ana na radio ụfọdụ ga-anọrọ n'ụlọ na-ata afọ na-eri ihe dị ha mma ọ na-adịkwa mma mmadụ nọkọta ọgọkwuru dọkịta mepie enyi ka ọ na-adụzi ya anyị kene unu na-asị ndị mmadụ ha tụgharịa na ebi ndụ fa ọ na nke a na-akpọ ọgwụ eze ka stega ndị mmadụ ha na-ebi nne ụfọdụ
Viagra ka ị na-ekwe.
Hello?
Viagra.
Viagra ka m kwu.
Okay.
Ndị mmadụ ụfọdụ yuzie ma ndị na-adị etozutara oke iyuzie na anyị na-ejikwere enyemaka na-enyere anyị aka na-adịkwaba anyị nwa kapa nwee ike na-eru n'uso unu prescribe ya dị na famasi wee gotezie mama nkịta ọzọ onye ọbụla mazi ụzọ ochie ya aka na-eto dọkịta ka ndị be anyị ya ọkụ dọkịta ka dọkịta gwa ihe a ga-eme ọ bụ anyị egote na famasi gotenye ha hazie gote ụrọ mgbe mmadụ ya were prescription enyi ya wee tekọlụ famasi ka onye ya ọgwụ ọdụrọ ka ndị be anyị tie hapụ ibe lifestyle a ajụjụ ntụ anyị dị ma ụmụ ihe energy drink a ozugbo akọp ya dịka predictor na mama with akọp.
Okay, sir, please keep listening to your radio. And is energy drink actually bad for the kidney?
Okay. Well, you know that word energy. How much energy do you need? So this drink provides you with a lot of sugar. Provides you both a preservative. Have you tested that drink before? I've been opportune to give a test. In fact, I just remember, like, that drink is very, very strong, and the kidney is actually involved in removing those things. And the main purpose of that drink is to give you what? Energy. And it can give you energy more than the ones that you actually require in your system. And by so doing, it's putting a lot of job on your system kidney. And on your kidney. And by the time your kidney start filtering those things, I forgot to also mention that this everybody wants to be fair these days too.
Okay, bleaching the skin.
Hey, that's another. I've seen, like, in this town, I've seen some people that developed kidney failure
as a result of bleaching the skin.
Bleaching.
Wow.
So we have a lot of skincare products, both licensed and unlicensed. I don't want to mention name of brands.
No, you're not allowed, because they didn't even pay me for adverts. So continue.
So people use those products, and before you know it, it causes a lot of issues in the to this person. You know, the skin, our skin has the largest amount of blood vessel. Okay, in it. So there's no part of the skin now that you will touch that you won't see blood vessel that is linked to it. So this blood vessel takes up these heavy metals from this cream we are talking about. And guess what? The kidneys are the receiving end.
Wow.
And this kidney we're talking about starts working before the the baby is born. So inside the womb, this kidney have already started working. About 12 to 13 weeks. A baby passes the first urine by 13 weeks.
Wow.
So from 13 weeks till this is expected to work all through this person's life. So, and you are sometimes it needs to be pampered. The kidney needs to be pampered. You are now giving it a lot of workload to do. Before you know it, the person's kidney can actually pack. And I know we are going to talk about the treatment of kidney disease is very, very expensive.
Okay, so how do we care for? Okay, let me take this call. Hello, good afternoon.
Hello, good afternoon.
You're welcome to the program. Your name and where you're calling us from?
How are you?
I'm fine, sir. Tell us your name and your location.
Oh, good afternoon, sir.
Yeah, welcome, sir. Nurse Victory.
I'm Pius Ishaoga. I'm calling from Bokos.
Okay, go ahead.
Do you know why people practice self-medication?
No, tell us, sir.
The reason is this. When you go for medical checkup, you have to pay 3,000 naira at the bank before you see doctor that will take you. And remember, such person may come to Abakaleke Peter 2. Maybe from the place he will spend up to 7,000 naira before reaching the hospital. That's the problem of people. And instead of going to hospital, they will go to pharmacy or to any place and buy whatever and continue to drink. And before you know it, the thing will become out of hand. That's the main problem.
So what do you advise?
My advice is this. If government can help and reduce that very amount of money.
Was the money fixed by government? Sorry, sir.
He's in the boy state.
Sorry, sir. I want to ask a question.
Okay.
You said you are calling from Umbo Court, right?
Yes.
Okay. The money you are to pay, where do you pay into government account?
It's the first amount.
Okay, to FETA.
It's not the government, yes.
Okay. All right. Continue what you were saying.
That amount of money, 3,000, we are paying.
Before seeing the doctor.
Before seeing the doctor at the bank. During LASA, it was 500 naira.
Okay.
From 500 naira to 1,000 to 2,000, it is now 3,000 naira.
Okay.
And before, at least next year, it will be up to 5,000. And just think about it. Somebody that will be coming to Abakaleke, maybe from Niger State area, going and coming back. Let government help to reduce that amount of money.
Okay.
So the patient will eat, he will pay transport fare and pay that very money. That is it.
All right. Thank you very much, sir, for that contribution. Anybody who is listening, I think they are listening. Government is listening as well.
Yeah,
they are going to do something about it.
For the cost.
Okay.
For the cost.
Yeah.
Healthcare is money. Even for the FETA, I understand that they need to pay workers, they need to generate some internal revenues to keep the hospital running. Okay, but FETA people have to answer that. I'm not saying the capacity of FETA. Okay. What I want to say is that to help people access health more, we should learn how to use health insurance. I think we were discussing about that before the program. So health insurance is actually very, very important, and we have national health insurance, and we now have a Ebonyi State health insurance scheme, right? So the truth is that most of our people don't have knowledge about this government projects, and they don't know how to key into it. So I believe if things like this are on ground, if the people are sensitized more about it, my brother now, when they have health insurance, it can actually cut down.
Okay, hello, good afternoon. Hello. Yeah, your name and where you're calling us from?
I'm calling from.
You are calling from? Please do call us back. The number is 0813-593-3112. Now that we have talked about how the lifestyles or how we can live a life that will help us manage and take care of our kidney. Hello, good afternoon. Good afternoon.
Good afternoon.
Your name and where you're calling us from?
I remember your previous caller, Comrade, and Patriot and Samuel.
Comrade?
Patriot and Samuel.
Samuel, all right, so go ahead.
It is on this issue of health education that people are facing. Based on the address of the Onovo, Dr. Onovo, I heard him mentioning NHIS, that the NHIS is now a NHIS. Even if that's a partaker of that NHIS, if you still go there, they'll tell you that there is no drugs to be administered. Unlike some time ago, it happened to me at Napa Hospital when I took my grandmother, who is a pensioner, to the hospital. She's under NHIS. They said I should pay consultation fee. That is 3,000 naira.
Okay.
Which I did. They told me to come on Wednesday by the optician that's supposed to take care of her.
Hello. Okay, I think on this issue we may have to bring the boss of NHIS or whoever is in charge to come and address this one. Today we are looking at you and your kidney. We are helping you manage your kidney so you don't have to go down to the extent of going to the hospital to go and queue up. You only go there to go and check and come out without spending too much. So that is why we are here in the studio today, and that is what we are doing. I think network did not allow us to get clearly that man's message. But anything that has to do with NHIS or Ebonyi State Insurance Health arrangements, we'll have to bring in the boss to tell us why you have to pay the 3,000. The Nurse Onovo Victory here is here to tell us on how we can take care of our kidney so that we can live longer. Hello, good afternoon.
Hello.
Good afternoon. Your name and where you're calling us from?
I'm Joyce from Ishago.
Okay, Joy, go ahead. If you are not calling in to ask us about NHIS, please go ahead with your question.
I want to ask a question.
Go ahead.
Is family planning 3 months affect the kidney?
Okay, all right. Thank you. 3 months family planning. How does it affect the kidney? And when we go for family planning, how does it affect the kidney?
Okay, family planning, when procured properly from the right government channels, blocks off any possibility of complications that may actually affect the kidney. So before you get family planning, they will have to take you through some routine investigations, then ask you questions, then help you select the one that suits your body. And they ask you to also, if you notice anything, you should come. So the problem arises when you start noticing something and you don't say something.
Okay.
So,
hello, good afternoon.
Good afternoon, sister. How are you?
I'm fine, sir. Your name and where you're calling from?
What is my name? I'm calling you from Ecom, Cross River State.
Ecom, Cross River State. Okay, go ahead.
Yes. So, please, I would like the doctor to throw more light on how to manage, how to prevent because I did not follow you from the beginning. I didn't follow that from the beginning. I'm just thinking. So I want you to just to throw more light on
how to care for your kidney.
Things to take and things to avoid based on those energy drinks, all those alcoholic.
Yes. All right, sir. Nurse Onovo, you are
okay. The first caller was saying something about alcohol and also saying something about soft drinks. I think he was like, which one should we take and which one
is more dangerous?
Yes.
And all of that.
So I think let me see if I can actually address that. The truth is that natural things are actually best for your kidneys. It gives them lesser workload. So if you're taking soda, you can tell you the amount of sugar that is being used in preparation.
You know,
of
when
those
you
foods.
talk soda, people don't understand that all the minerals are
Yes.
under that classification,
Yes.
soda.
So all the mineral, like I think mineral is actually a very common word.
Word, yeah.
Like saying soda. So all these minerals, they are not actually okay. If they take the amount of sugar they put inside there, you yourself you will marvel. So some people have the habit that they can't eat a meal without having one of it. Then for alcohol too, both of them are not okay. There's someone now ask me now, what should we drink? We should go for natural drinks.
Okay.
We have
Like
tiger nut drinks. We have smoothies. So all these things you can actually take them.
Zobo is okay, right?
Zobo is okay, but I'm not a fan of Zobo.
Oh, that's why you don't want to talk about it. But then Zobo that is not filled with sugar and all the flavor and all of that is good because it's natural.
Then
when you don't add all the additives.
Yes, another thing is too much of even a good thing.
Okay, too much of a good thing.
It's also bad.
Like?
So if Zobo is also good, if all this is also, if you consume them out of proportion, you can also endanger your kidneys.
Okay.
Then I've also said that water is life. So you drink a lot of water and keep yourself going. Then if you must take a drink, like you must take something. Fruit juices are there. Not this canned fruit juice, the one you make yourself. You can buy that juicer in your house and use it to make your juice.
Okay.
Or you buy your range and people tell you all those, you can make out something from it.
Go natural.
Go natural. Then often eat at home. Eating at home is better than eating processed meals outside. We have a lot of processed food these days. We call them even
fast food.
Fast food. Even the noodles that we take, spaghetti. It's not the name of a brand, right?
Yeah.
All these spaghetti and all the rest of them. By the time you keep taking all those things and loading your system with artificial, because if you notice, like our conversation, you notice that before now, we hardly hear our parents suffer from kidney failure.
Even kids. I'm surprised that sometimes you see kids, they say there's kidney failure, there's this, and you wonder how it started.
When I graduated from school, it was very difficult for you to see kidney failure patients.
Yeah.
You see them once in a while. Then I started working. One of the things that happened when I started working, the first place I was posted was a dialysis unit. That was how I got interest, and I went to do my specialty there in kidney. Now that I came out, do you know that a particular hospital in this country used to get about 200 dialysis patients every day?
Wow.
It's not like they are doing any particular program. They will come.
People come
every day. They do a turnover every day. Then, if you want to notice, if you want to see if what I'm saying is the truth, visit FETA or not fake. You will run or go to do foods when they did their free dialysis. So these are the things that you need to do to safeguard it. Then avoid self-medication. Avoid self-medication. No matter how ego carrying heji as well. So I know that the money could be expensive procuring health, but it's actually better because it's the health that you need to enjoy life.
Okay, so the last caller said he wants to know what to do to take care of his kidney, so that he doesn't break down or the kidney doesn't fail.
I think that's part of what I'm saying.
Yeah, it's part of what he said. So then over again, let him hear it.
Then for that particular caller, don't use organic creams or what do you call it, bleaching creams. Okay. Then don't even use it for your child. A lot of mothers now use it for their children. Then take water, take enough water, not a lot of water, take enough water that's required for you. Then those who are active should drink more water than those who are doing office job like this. So then if you're going to sweat it out, make sure you replenish it as much as you do. Then stay away from artificial meals, go natural and all the rest of them.
Hello, good afternoon. Your name and where you are calling from? Hello?
Hello.
Please step away from where you are. You may.
Hear me?
Okay, I can hear you now. Go ahead.
My name is Luke Adachi.
Your name is?
Hi, Chief.
Hi, Chief.
Luke Adachi.
Please call us back, okay? The number is 0813-593-3112. Before you call, step away from your radio and shift a bit from your location. Hello, good afternoon.
Good afternoon.
Your name and where you are calling from?
Raymond is the one calling from you.
Raymond, go ahead with your...
I want to ask you a question.
Go ahead.
Our grandfather lives long. with all their herbal concoction. Why do medical doctors are not used to criticize herbal concoction?
Okay.
I want to know, if it's not effective, let us know. That's
Okay.
what our forefathers used and live long and live above 100 years above. Thank you.
Okay. So you heard him. I think our forefathers were more on natural food then
Yes.
than now.
Yes.
That
See,
so go ahead.
when we
And
talk about, when we
respond to
try
it.
to compare our grandfathers and our present day reality,
Okay.
they are two different things altogether. You know that the way we look for money these days is not the way our grandfathers look for money. When you're going for when you're going to a herbalist, the person you're meeting is either the person learnt it from the father, or there's a training that was done for the person to be able to dispense that care. And when they are doing it, they don't just combine a lot of roots and not the rest of them. They may get a specific one and tell that take this one for so. But the problem we have these days is that, have you seen where they prepare those herbal concoctions?
I don't know why I'm laughing. I saw one the other day.
If you see people who sell this herbal concoction,
The environment where it's prepared and all of that. Okay.
so then another problem we have with them is the dosaging. Most of them
Okay.
don't have dosage, and most of them don't follow. Like, we have herbal remedies that works, that have followed standard medical guidelines. If you go to America, they still use some of their herbal products. So, but our people cut corners, and that is why so many people end up consuming more poison than their body actually needs. That is why most of the time we try to tell these people to get registered, get censored, and not the rest of them. But ordinarily, the one of that it doesn't have label, it doesn't have anything. You just buy, give me 20 naira short. Although that's the one we are against.
Okay.
So a lot of all these other things that we need to take care of.
Okay, all right. Yes, still on to sort of Abakaliki. Why I'm actually laughing is because that man's question is funny, but it's very important, because it's as if everybody's condemning our herbs. Why we buy some of these herbs too from Obodo Yibo? Why is it that our own is not, everybody's against our own? I think that's his question. And the way he asked the question was very funny. But thank God that you've made it clear to him a lot of things, because during our father's time, our grandfather's time, like you said, some people inherited this thing, like akaraka. So when they bring a particular leaf, they will tell you that this is for malaria, and it works. And they will tell you take it for 2 days, and it works. But now they will mix like 10 herbs together, and you won't even know what you are consuming, and you will keep drinking and it's not working, because some people are using it as business, no longer as it used to be. Okay. Hello, good afternoon.
Good afternoon. This is James from Example.
Okay, go ahead.
Okay, I want Doctor to throw more light about what we'll be eating, taking care of ourselves, because his voice is off and on. We don't hear him full like that.
Okay.
And he mentioned something about
Please don't use
I
bedroom
don't know
voice.
whether those people chop it, eat it raw or something like that, whether I can hurt kidney as well.
What?
What
did you say?
Ginger, organic, all those things. Does it hurt kidney?
Okay, please respond to him.
Okay, I'm sorry that my voice is going off and on. I didn't know about that.
Yeah, we need that.
Okay, so what I'm actually trying to say, for the question you asked, ginger, garlic, and all the rest of them, all those natural herbs, they are actually all those natural spice. They're actually very, very okay. Okay, so my point is, if you want to take ginger, I take ginger, I put it inside my water, and I take it. Actually helps to clear the throat. So where the problem lies is that you get ginger, you get dogoyaro, you get name them and join them together and start taking. So when issue starts, when maybe your system starts reacting to that, how do we know the one that you took that is actually one that's actually causing the wahala? So that is the problem. So if you're taking ginger, let it be ginger. If you're taking garlic, let it be garlic. So that if there is any issue, it can actually be traced and it can actually be addressed.
Okay, and then moderation.
Yeah,
so
then moderation also is
moderation.
the key. So it's not something that you like because they tell you that this thing is okay. You want to now use it. You know, there was a time they said alcohol was a little bit percentage of alcohol was okay. People now start drinking to stupor. Thank God that we now have a recent research that says zero alcohol, that even little alcohol is as dangerous as taking a lot of alcohol.
Okay, so what are the preventive measures? How do we treat this kidney issues?
Okay, before we talk about how to prevent or the treatment remedy that's available for kidney issues, like you're saying, I want to also bring it to the fact that during our forefathers, during the days of our forefathers,
Okay.
we didn't have a lot of spices for cooking.
Okay.
We just had
seasoning.
Seasoning
because
yeah.
we have natural spices.
Yes, natural spices.
Okay.
Either you're using curry, you're using. But now, if you go to the market, I was in the market this morning. I saw a lot of them. So kidney treatment is actually very expensive. Like I said earlier, that the kidney will not give you a sign that it is failing until about 90% of the kidney has been destroyed. So and say with that knowledge, it's very important for you to guide your kidneys with all diligence, because God gave us two, and the truth that both of them work hand in glove. And any condition that affects one can actually affect the other. So that is why
is it possible for the two kidneys to pack up at a time?
Most of the time, the two kidneys pack the same time.
Wow.
Okay, so but if one kidney has issue, the other kidney can actually
carry on.
So the problem arises when both kidneys have issue. So it could be due to diabetes. So if you have diabetes running in your family, like your family member has diabetes, maybe your father, your uncle, or one of your siblings has diabetes, it means that you also are at risk. So you need to do everything you know you can do to make sure that you don't develop diabetes. And even if it happens, you can also make sure that it doesn't go out of control. Okay, that is between the normal range. And try as much as possible to make sure that you're bringing it down with food and exercise and all the rest of them, and that the drug is doing little. Okay, so these are the things that we need to do. Same thing goes for high blood pressure. Same thing goes on what we eat. We can't overemphasize on what we eat, because whatever enters into your mouth, enters into your system, has a way of determining how your health is going to be in the next few years, in the next few months. Okay, if you eat nonsense, your body will become another thing altogether. Then for treatment, we said that we have stage 1 to stage 5. So when the kidney chronic kidney is at stage 1 to 4, you can actually manage the symptoms, manage the causes without dialysis. But when it has entered stage 5, that stage 5 is the one that is known as end-stage renal disease. So this end-stage renal disease is the one that requires you to do either transplant or to continue doing dialysis. A session of dialysis today, as I speak to you, is about 50,000 naira.
A section. And how many sections do you need in a week or in a month?
The person who has kidney failure needs about 3 sections in a week. That is 150,000.
50,000?
Yes. So, and this one is also expected to do it for life. So imagine 150,000 per week. In a year, in a month, how many? Let's do the calculation. Then in 2 months, how many? That's why people sell their properties, and at the end of the day, they still die. So then, apart from what do we call it? The dialysis. This person needs to take drugs. I remember I said something about their blood.
And dialysis is different from the drugs. The price for the dialysis is different from the
very different
drugs.
This person needs to take high blood pressure drugs and a lot of other medications that will be given to this person. So, and this person will also need blood. Their PCV is usually low as 18, 12, and thereabout. So,
and the normal PVC should be what?
Normal PCV should be between 34, 44 to about 55.
Okay.
So someone with kidney failure may be having it as low as 12, as 13, even 7. I've seen 7. So most of them, they will now need multiple blood transfusion, and this is money. So it's kind of someone coming to dialysis with 50,000 may end up spending 80,000 in the hospital. And when you're coming back, hospital now, they give discounts. No matter how sick you are, they can't give you a discount, because if you're going to
no credit.
Yes, you need to pay. Then if you're using private hospital, they are there for money too. If you're going for government hospital, they need money to keep the system running. So it is better that we care for our kidneys. Then we talk about transplants. I know that people raise money for their friends to do transplants. Transplant costs about 30 million naira in Nigeria today. So how many civil servants, how many farmers, how many of us can actually
afford that?
30 million in their lifetime? So this is a condition now that requires the person to do 30 million naira. And by the time this person does this transplant, that's not the end of it. There's something we call post-transplant drugs that this person needs to be on all the days of their life, as long as they want this kidney to remain. So they take these drugs. These drugs are also very expensive, mostly imported. So a lot of even I don't talk about what happened during COVID. So apart from this person needs money. People contribute money for people, do transplant, and they leave those people. They don't even have jobs to start buying post-transplant drugs, all these their immunosuppressant drugs. And before you know it, 2 to 3 months after
the transplant,
the kidney fails again. And they not say that it's village people. It's not village people. It's because there's something that this person is supposed to be doing. Then if you don't protect the new kidney from what actually caused the first kidney to fail, that new kidney is also going to fail.
Well, this is why we call it a wrap on the program today. You heard him right. If you don't do what you're supposed to do, your kidney will go down. And when it goes down, you keep spending money all the days of your life till you leave this earth. And with what is happening with our economy, we all need to be very careful with ourselves and our lifestyle, and so that we can at least live to enjoy this life that is this beautiful and sweet. And this is where we are going to match the break on the program today. So join us next week Saturday for another interesting edition and interactive time here on Salt 98.1 FM Abakaliki. I'm your girl Lovers Onyebucha. In the studio with me has been Nurse Onovo Victory. He's very passionate about you and your kidney. Have a wonderful weekend.